Hello everyone, today's subject is gestational diabetes test. Still highly open to discussion as a subject in question. Let's take a closer look at this. What is gestational diabetes? Although the mother-to-be does not have diabetes before pregnancy, there may be an increase in the level of glucose in the blood during pregnancy. This is a development that will indicate gestational diabetes in the expectant mother. This problem can be detected in the screenings to be performed with the sugar loading test, also known as the sugar water test, performed at 24 and 28 weeks of pregnancy. How is gestational diabetes determined? Sugar loading test should be applied to expectant mothers between 24 and 28 weeks. During the test, the expectant mother is first given 50 g of glucose to drink. An hour later, the blood glucose level is checked. During the determination of this ratio, when the glucose level is below 140 mg per dl, it is determined that the expectant mother does not have gestational diabetes. However, if the glucose in the blood is above this value, the test should be repeated with 100 g glucose for 3 hours. After 3 hours of loading, it is determined whether the expectant mother has gestational diabetes or not. After the sugar load test to be performed on the expectant mother, excessive physical activity should not be done and nothing should be eaten during this process. These are important for the sugar loading test to give accurate results. What are the risks of gestational diabetes for the mother and the baby? The presence of diabetes before pregnancy or its emergence during pregnancy creates some risks for the mother and the baby. The more regular the blood sugar levels are ensured in this process in pregnant women with diabetes, the less the risks due to diabetes. The risks of gestational diabetes are less than those of diabetes before pregnancy. However, this must be determined and treated with a sugar load test in pregnant women. Otherwise, problems such as pregnancy poisoning, high blood pressure, premature birth, and miscarriage in expectant mothers will be higher than pregnant women who do not have diabetes. Babies of women who had diabetes before pregnancy may have some anomalies. However, gestational diabetes does not cause such a problem. However, in both types of diabetes, the baby may be born overweight, that is, macrosomic infant development may occur. In this case, since the mothers will be delivered by cesarean section, there may be some risks related to this. When blood sugar levels are controlled during pregnancy in expectant mothers, the risks that may occur will decrease proportionally. Therefore, it is extremely important to monitor HbA1c and glucose levels in expectant mothers. How is gestational diabetes treated? In case of gestational diabetes, expectant mothers are not given oral diabetes medications like normal diabetics. Instead, treatment methods such as diet and exercise practices and insulin administration are preferred. With the diet program prepared by the doctor and dietitian together, suitable for pregnancy, the expectant mother is fed. Chocolate, ice cream, desserts prepared with sherbet, foods made from white flour are not included in this nutrition list. During this diet, the mother-to-be does the exercises recommended by the doctor, which is also effective in regulating blood sugar levels. These exercises should be chosen from sports such as walking and swimming. Diabetes mellitus is controlled by giving insulin to expectant mothers for whom these practices are not beneficial.